Welcome back to the show. We are really lucky in this area to have amazing healthcare options that are really leading the way in patient care. One of those places is EvergreenHealth's Eastside Neuroscience Institute, and I'm joined by their Executive Medical Director, Dr. David Lukowski. Thank you for being here.
Thank you for having me.
So let's talk about the Eastside Neuroscience Institute. I know a lot goes on there, but could you try to pare it down?
Sure. So the Eastside Neuroscience Institute is a partnership between EvergreenHealth and Overlake Medical Center and Clinics, and we partner in the areas of neurology, neurosurgery, and spine. So it does cover a lot of territory.
I mean, that's everything from the neck up, every disorder you can imagine, right?
Pretty much.
So how does the Eastside Neuroscience Institute, how is it impacting healthcare on the East Side right now?
So we're really bringing world-class care to the East Side. You know, the East Side used to be a pretty small, kind of quaint area, but that has changed a great deal. And so with the number of people on the East Side and the sophistication in our level of care increasing more and more over time, we have really developed tremendous centers of excellence.
You know, when seeing two big organizations like this come together, you know you're going to have just all the tools that you need. Tell us about some of the cutting edge technology that you have.
So one of the really cool things about neurology, neurosurgery, and spine care is that our care is getting better and better all the time, and our ability to impact things is better.
Right.
Even at the time that I've been in medicine, say with stroke as an example, we used to not be able to do too much. We are now able to actually go in and remove blood clots in the setting of stroke.
Really?
Patients who used to go to nursing homes, unable to move, unable to speak, sometimes now leave the next day doing fine.
Unreal. So you're going in the deep vein work. This is unbelievable. So you're doing stroke care, and then what about, when you mentioned spine, I said the neck up, I was joking, but the entire spine, are you doing back care as well?
We really are. And so if you look at a lot of these conditions, some are very common, right? Headaches are very common, back pain is very common.
Yes.
We all suffer from those things, and we now have a lot of different treatments than we used to. We have better understandings of how those things work, both from surgical treatments and ideally non-surgical treatments for all of those.
Well, that is good to know. What are some of the kind of, just give us an array of things that you're working on right now, some of the things that you feel like are impacting patients the most?
Sure, so we do a great deal of research, and so things from treating Parkinson's disease, we have implantable devices, brain surgeries that help decrease tremor. We have surgeries for spine. If there's impact from a disc on a nerve, we have minimally invasive ways of addressing that. And so it's really a broad range of all of those things, up to aneurysm care, brain tumors, so really from back pain and headache, which are super common, to the much less common and very serious, not that the others aren't, things that we can address now.
With the work you're doing, and you mentioned much less common, I mean, some of the discoveries and the research you're doing, is that helping those rare diseases and rare things?
It really is. And so really the foundation of much of this is a large research group, and then physicians working together building on that. And we've continued both, and then with the two hospitals coming together now to really care for our community and our patients.
Unreal. So what would you say to people who are watching this right now, suffering from a condition, headaches, nerve pain, backache, movement disorder? I mean, if they're sitting here and going, I gotta check this out, how do they get in touch with you? How does it all work?
Sure, so the most important thing is if you're suffering from an emergency medical condition, difficulty speaking all of a sudden, something like that, call 911. Otherwise, most of the time you can go through your regular physician or reach out to our website. We have neurologists, neurosurgeons, physiatrists, really neuropsychologists, a broad array of clinicians at both hospitals. And so reaching out through our website or through their primary care provider is a great way to do that.
Oh my goodness, there's going to be so many folks who are going to find relief thanks to you. I really appreciate you taking the time to come and talk to me. Again, I know you cover so much. I feel like we barely breached the surface, but I'm glad to know what both organizations are doing. So thank you so much for coming in today.
Thank you for having me.
Absolutely. And if you want to learn more about the things we discussed and the things we didn't discuss, please visit the website on your screen. We're also going to have more info on our website as well. Well, we are also learning about an organization that is working to fight poverty in Central America by giving people jobs in agriculture. My neighbor is a volunteer, and he's here with the program to talk about why it's such a great cause when we come back.
This portion of New Day Northwest is sponsored by EvergreenHealth.